Welcome to CBCA's first Arts and Wellness Forum of 2021. I'm Kristen Crampton Day, Executive Director of Colorado Business Committee for the Arts, CBCA. Thank you for joining us this afternoon. This event is the first in a series of 3 forums we have planned for this year that explore the intersection of arts and wellness. This multifaceted relationship can positively impact our individual mental health, help battle workplace stress, improve public health, provide societal healing, and foster equity and access for all. A few Zoom tips and housekeeping items for this virtual event. Please keep your microphone on mute to avoid background noise. You are welcome to turn your camera on or off as you prefer. When we hear from our various speakers, you may wish to turn it off or switch to speaker view so the speaker takes center stage. We encourage you to use the chat feature. That's how you'll share comments, ask questions, and eventually request a one-on-one artist-led resiliency moment at the end, which we'll talk more about later. Take a moment now and introduce yourself in the chat. Let us know who you are, what you do, and where you're coming from. I'd like to thank our wonderful partners who support these forums. Thank you to our 2021 Forum Series sponsors, College of Arts and Media at CU Denver, Denver Business Journal, the Melvin and Elaine Wolf Foundation, and Polsinelli. I'd also like to thank the Center for Bioethics and Humanities at CU Anschutz for supporting this particular forum. They have an incredible arts and humanities and healthcare program. And now to share a little more about the College of Arts and Media, please join me in welcoming CBCA board member and Dean of the College of Arts and Media, Larry Captain. Larry, take it away.
Oh, thanks so much, Kristen. Let me just say that our relationship with CBCA is such a synergistic one because we all have the same goals, and that is to support businesses and the creative industries. And those two go together quite a bit. Part of what we do at the College of Arts and Media is we try to prepare students for the future that we don't even know about yet. In that regard, we just made a hire, and he's with us today. He starts July 1st, our new Associate Dean for Transdisciplinary Research and Innovation, is a public health specialist as well as an artist. His name is Theo Edmonds, and he's on board today with us here. So we're looking forward to integrating Theo into the community of medicine and practice and public health and arts and CBCA. So yeah, that's just Theo's with us today, and we're really glad to have this relationship with CBCA in this forum series. Thank you, Kristen.
Wonderful. Thank you, Larry, and welcome, Theo. Looking forward to meeting you and working with you. We are so grateful for CAM's ongoing support for this forum series. You've really been with us since the very beginning in 2018, and we really appreciate it. Now I'd like to recognize another Arts and Wellness Forum Series sponsor, Polsinelli. We are joined by Managing Partner, Jennifer Evans.
Hey, Kristen, thank you so much for the introduction, for the opportunity to support your work. I'm the managing partner of Polsinelli and also a healthcare lawyer. For those of you who don't know us, we're about 900 lawyers in 20 cities across the country, but the largest healthcare practice in the United States. And so we have a wonderful opportunity to work with healthcare providers across the country. And we really have never, in my 10 years of Polsinelli, worked with CBCA. And I don't know why. We have so many colleagues who are amazing patrons of the arts, but it's just never connected until we saw this. And when we saw this series, we thought, oh my goodness, this is right where our heart is and right where our clients are. So we have a little kind of thank you encouragement video that I'm going to ask Meredith to play. Thank you for your good work and for your allowing us to help you with it.
Thank you, Jennifer, for sharing that. I started to get a little teary-eyed watching some of those early slides. It has certainly been a year, which I know we will be talking about a little bit more today. But thank you, Polsinelli,
Thank
for
you.
your support. And I hope it's a long and fruitful relationship.
Me
We're
too.
thrilled to be working with you. Next, I would like to turn it over to CBCA's board chair, Chris Ross, to share a little bit more about CBCA in this forum series. So Chris, take it away.
Great, thanks, Kristen. Hello, everyone. Thank you to all of our forum sponsors and partners. I'm Chris Ross with US Bank and CBCA board chair, and it's great to see so many of you. Hey, CBCA's mission is to advance Colorado's creative economy by connecting arts and business, and we do that through advocacy, research, training, volunteerism, arts engagement across the state. We are a robust membership organization with over 200 companies from 21 different industries. CBCA launched these arts and industry forums in 2018. I can't believe it's been 3 years already, and such a success. And we did this as a way to foster deeper dialogue at the intersection of arts and business. Each of the forums looks at a unique and dynamic connection between the arts and a specific business sector relevant to Colorado. For 2021, we decided to take a deeper dive into the partnerships between arts and wellness, such a timely topic, as Kristen alluded to. Today, we'll be focusing on how Colorado is leading the way to integrate creative arts therapies and innovative arts programming to build resiliency for healthcare workers. Our next forum will be in August, and will be an interactive exploration of self-care and mental health through the arts. And our final forum is in November, and that will examine health equity and accessibility in and through the arts. We invite you to stay connected with CBCA through our website and social media after this event to learn more about the many ways arts and business work together in Colorado and how you and your company can get involved. To center us in today's dialogue, which may be difficult at times and uplifting at others, we've asked Michael Henry, Executive Director of Lighthouse Writers Workshop and a member of the Colorado Resiliency Arts Lab team, to share a poem. Mike?
Thank you, Chris, and thank you everybody for being here. I'm just going to read a short poem. If it's okay, I'd like to share screen so you could actually see it as I read it. Okay. Let's go full screen. Hopefully you can read that. Let me make it a little bit bigger. So I'd love to read this poem. It's by Ada Limon, who's just this incredibly talented poet. And I think this is a great example of how artistic experience, when it's portrayed well, shows you how, if you're present in the world, no matter what you're going through, what you're suffering from, you can find beauty and you can just sort of find a sense of renewal. One quick thing about Ada Limon is that she suffers from an autoimmune disease. So you'll get a sense of that through the poem. And it's about horses. So if you like horses, this is right up your alley. American Pharaoh by Ada Limon. Despite the morning's gray static of rain, we drive to Churchill Downs at 6 a.m. Eyes still swollen shut with sleep. I say, remember when I used to think everything was getting better and better? Now I think it's just getting worse and worse. I know it's not what I'm supposed to say as we machine our way through the silent 70 minutes on 64 over pavement still fractured from the winter's wreckage. I'm tired. I've had vertigo for 5 months. And on my first day home, he's shaken me awake to see this horse, not even race, but work. He gives me his jacket as we face the deluge from car to the twin spire turnstiles. And once deep in the fern green stands, I see the crowd. A few hundred maybe, black umbrellas, cameras and notepads, wet-winged, eager early birds come to see this Kentucky-bred bay colt with his chewed-off tail trained to the end of trained to end the almost 40-year American Triple Crown drought. A man next to us, some horse racing heavy, ticks off a list of reasons why this horse, his speed-laden pedigree, muscle and bone recovery, etc., could never win the grueling 1.5-mile Belmont Stakes. Then the horse with his misspelled name comes out, first just casually cantering. First just casually cantering with his lead horse, and next a brief break in the storm. And he's racing against no one but himself in the official clocker, monstrously fast and head down so he can see that faded star flash on his forehead. Like, this is real gladness. As the horse eases up and we close our mouths to swallow, the heavy next to us folds his arms and says what I want to say too. I take it all back.
Thank you, Michael. That was wonderful. Sorry about the little interruption there. You did a beautiful job. For many of us, if not all of us, the past year has highlighted or intensified our daily stress and how we cope with it or not. This is particularly true of healthcare workers who have been battling burnout, compassion fatigue, and trauma long before COVID-19 pandemic. We will be focusing today's conversation on cutting-edge initiatives here in Colorado that are leveraging the arts to address this issue. We'll begin by hearing from Tara Rynders, a dancer, nurse, and artistic director and founder of The Clinic, an arts-based immersive theater company that offers workshops for healthcare professionals. Then we'll hear from Dr. Mark Moss, head of pulmonary sciences and critical care medicine at CU School of Medicine, and another member of the Colorado Resiliency Arts Lab, or CORAL, team. From there, we'll transition to a panel discussion facilitated by Michael Henry, in which we'll hear from the artists, arts therapists, and healthcare professionals who are participating in these initiatives. And finally, we will invite you to experience this work firsthand. We will have some breakout rooms set aside for participants to have a one-on-one artist-led resiliency moment, which I know I'm really excited about. We'll share more about that, but if it's something that you might be interested in, please take a moment and send a chat message to CBCA, and we'll have those breakout rooms ready for small group networking as well. So with that, I'm going to turn it over to Tara to tell her story and share the work of the clinic. So welcome, Tara.
Thank you, Kristen. Hi, everyone. My name is Tara Rynders. I am a nurse and an artist, and I'm really just grateful to be here. So thank you, Mike, for that beautiful poem, and thank you, Coral and CBCA, for having me. I feel just overwhelmed right now with gratitude to be here in this space with you all, so thank you. I'm going to share my screen and begin presenting on the clinic. All right, so as mentioned, I am the artistic director and the founder of The Clinic, an arts-based immersive theater company that creates workshops and performances inside the hospital setting. And I want to just thank a couple of the sponsors and supporters below: Blade of Grass, Rose Medical Center, Arts and Society, Imagine 2020, Reimagine End of Life, and the Hemera Foundation. I'd like to share a little bit of my background. So as I said, I'm a nurse, but I'm also a sister and a daughter and a mother. And those are really the beginnings of where my caregiving began. You could see in the middle is a picture of my beautiful mother who passed away in 2006 from cancer. And I took care of her until she passed. And that was a very informative period for me of what it means to care for another human being, all the way to their transition through death, and specifically being my mother. And on the far left, you can see in the middle of the picture is my sister who had went into a coma, and I actually lived with her in her rehabilitation room for many months and slept by her side in a cot and was working with her to help her learn how to eat again and move again, and just had this very intimate experience that really is the basis for a lot of the work that I do in these one-on-one interactive arts-based experiences. And then in the middle is my brother who suffered from mental illness and unfortunately passed away inside the hospital setting at the age of 30, and at the time was incarcerated, and there was a lot of bias and poor treatment for him, which had a bad outcome in that case. And then on the other side are my twins, who are now 5, but when they were 6 months old, I was in the hospital with an ectopic pregnancy and almost died. And I remember in the midst of being completely passed out and bleeding internally, feeling so scared, my nurse, who was like my mother in the moment, took my hand and said, "I'm here and you're going to be okay." And I remember thanking her for seeing me and remembering me and my heart as a patient, as a person, as a human, despite all the other chaos that was going around. And that moment made me realize, oh, our nurses, our healthcare providers, they're everything to us when we're in these vulnerable moments. They can come alongside us in some of the hardest times of our life and ease it for us and care for us. And that's when I realized as a nurse the importance of my work, even more so than what I already knew, and yet also realized through research that the weight of compassion fatigue and burnout and what it was doing to us in our profession. This is a little bit of data from 2017, which I'm looking forward to Dr. Moss's presentation for some more recent data, as that's his specialty. But really, we don't need data anymore to necessarily know how we're suffering. And then leading into health disparities, the more I'm doing this work, the more the connection I'm making that our burnout is leading to poor patient outcomes. And when you're working within a system that values white supremacy, you're going to see these outcomes get even worse, specifically within burnout. And so my question when I do these workshops is to tie into care for our healthcare providers and also provide the space to get curious about what is our role? How can we be held accountable for our role in health disparities and racism at the bedside with our patients? So I'm going to stop sharing for one moment to show you a quick video of our workshops that I feel like gives a little bit of a view into the heart and soul behind the work that we do. And I'm also really excited because we have 4 of our incredible artists here. And we also have Gabby Mundy, who is a nurse that went through our workshop series. So let me share that.
I remember not really being able to have the compassion for somebody in their situation that I used to have, that I felt desensitized to their pain and their suffering. And after that, I realized I was tired and I was experiencing compassion fatigue. My name is Tara Rynders. I am a nurse. I've been a nurse for over 15 years, and I'm a dancer, and I am the artistic director of the clinic, which includes resiliency workshops for nurses and an immersive theater performance that takes place in the hospital setting to raise awareness of compassion fatigue and nursing burnout. The clinic is a 6-week workshop series for nurses to combat compassion fatigue and burnout through resiliency training with the arts, music, dance, and performance. It's based in play, so it brings us out of our heads and into our bodies. And just like children, we get curious again and we start thinking about things differently. We start questioning things. We use theater and acting and role-playing as a way to address certain really deep and tough questions and issues at hand, but do it through a playful lens.
I was surprised at what came out of that and what actually was causing grief that I was holding on to. And it was so great in all the different ways that we visited with the movement and sharing our stories with other nurses who I think when they heard them can really relate and connect.
I think just stress lives more in your body than you ever realize. And I think something that happened 50 years ago can be completely in your body, and you know about it. You hear about veterans from war, but you don't really know how it affects a person until you let it out.
Some of the worst days feel like they are connected intrinsically to who you are in this profession. That my value as a nurse is how I can take care of people. So on my worst days, does that mean I'm not doing a good job at taking care of people? And it's being able to kind of disconnect those two ideas.
So what motivated me for this workshop series is I had an experience as a patient where I almost died, and I realized how important nurses are, that they are everything to a patient. And I began researching patient outcomes, patient experiences. I wanted every patient to feel seen and heard and cared for every time. So I realized that compassion fatigue and nursing burnout was stealing the joy that we nurses can receive from caring for another human being, and that there's a huge need for our nurses to be supported and cared for and seen as nurses. The hospital benefits from every employee caring for themselves, because when a nurse is caring for him or herself, they're caring for their patients, and they are experiencing satisfaction as a nurse. They're empowered to care for others in a healthy way, which decreases turnover, increases patient satisfaction, nursing satisfaction. Ultimately, everyone wins.
This is a program for nurses by nurses, and I think that's one of the most important aspects of it is you're being understood, heard, and seen by someone else who has been through what you've been through, and maybe different stories, but the underlying theme is the same.
Working with performers has been a totally new experience for me, very outside of the box, and it's been a fun, new approach to looking at a serious issue.
Identifying that story and finding the ways to move to help you identify how that story really impacted you, emotionally and physically. Didn't even think that story affected me until she said that prompt, and I was like, oh, I remember that. Yeah, after that I was pretty pissed. And then I was like, wait a minute, I was more than that,
Being able to move my body helped me move through certain pieces of my story that weren't necessarily as comfortable. And seeing other people struggle with the same things I struggled with, it built a little bit of a camaraderie around, everybody who was in the group, that nobody's going through it alone.
A really important component of this workshop series is the IRB-approved nurse-led research study that we're doing, and we will continue to do with every workshop series, so that we're gathering data to create evidence-based practices that can be used for nurses, but also brought to the bedside and used for the care of our patients.
Wonderful.
Thank you. So just want to say that this quote was brought to me actually by Gabby, who's joined us today. And I think it's really prevalent to what we have gone through as a community of healthcare providers. Nobody escapes being wounded. We are all wounded people, whether physically, emotionally, mentally, or spiritually. The main question is not how can we hide our wounds so we don't have to be embarrassed, but how can we put our woundedness in the service of others? When our wounds cease to be a source of shame and become a source of healing, we have become wounded healers by Henri Nouwen. And that really is such the case of coming together and collectively caring. As nurses, we're healers. And so creating a space for us to care for one another was really powerful. And I'm excited to hear for you all to hear more about it on our panel. And I just want to speak briefly to our resiliency moments that I hope you sign up for today. It's an incredible opportunity to have these one-on-one moments with our artists. Sun Chung is joining us from New York City, and she'll be sharing a sound meditation with you. Abby Ahmed also is coming in from New York City. She's a musician and will be creating a song with you. Kelly Greenlight, she's joining us from Kenya. And I think it's like 1 a.m. her time right now. So Kelly, thank you so much. And Courtney is joining us, and they will be sharing with you a new resiliency moment, not one here not one that you see here where they invited you into their kitchen, but a different one outside. So if you would like to be part of a resiliency moment, please, as Rachel said earlier, or Kristen, to put in your full name. You can chat to everyone or chat to CBCA. We would love to have you experience these, and they're 10 minutes long. And I'm just going to show some pictures from First Do No Harm. This is back in 2018, pre-COVID, where we brought in artists and dancers and musicians into the hospital. We closed down the front door for like 15 minutes to do our opening scene. And what we did is we told the story of compassion fatigue and burnout from the perspective of the nurse, which was a perspective at this time wasn't heard from, as well as the family member, the partner of this patient who was dying. And this is death speaking to the patient and letting him know that he was dying, and doing a conference call and giving the details of a widowmaker, which is a heart attack that was killing him. And you see the guests who were invited to the show walking him to his gurney where he ended up dying. And it was really powerful. You can see the grief on his partner's face. And this is a grief as healthcare providers that we see every single day. But it was something that really impacted our guests to be able to see this grief firsthand in the hospital. I will be putting some other links in the chat if you're interested on seeing more stories and performances from nurses. And lastly, I want to share this quote: "Walk lightly that you see the life that is below your feet. Spread your arms as if you had wings and could dance through the air. Feel the joy of the breath in your lungs and the fire in your heart. Live to love and be a blessing on this earth." Susan Carlson. And with that, I will pass it over to Dr. Mark Moss, because I have been so grateful to you, Dr. Moss, for living to love and be in the way that you are a blessing on this earth. So thank you so much for allowing me to share with you today.
Thanks, Tara. I really, every time I watch part of your video, it's just very inspiring to me also. I'm going to share my screen. Make sure I did this properly. Can you see that, the slides? Kristen, somebody?
Yes.
Okay, so I'm going to make it a slide show. Go back to the beginning. So I'm just going to build on a little bit of what Tara and actually what Jennifer talked about also. And I just want to start off by saying it takes a team to do all this work. This is work we've been interested in for almost 20 years now. And it's nice that it's finally funded by the National Endowment of the Arts and by the National Institute of Health. And I also want to say I don't have any disclosures or conflicts of interest. So we use this term burnout, and I think it's okay. And we'll talk about that in a second. And really what burnout is it's a discrepancy between what you thought your job was and what your job really turns out to be. And an example of that is I don't think many healthcare professionals went to medical school or nursing school to sit in front of a computer and write notes for several hours at a time. And you can see how something like that would lead to not really enjoying your job as much as you thought. The other thing is burnout is a work-related problem. So people don't start a job with burnout, and it occurs gradually over time. The way I kind of think about that is for those of us that wear glasses or contact lenses, you don't really notice how your vision's slowly gotten worse. You go to the optometrist, you put on a pair of glasses, like, wow, I didn't realize I was supposed to be able to see those letters or the tree in the distance. But the people around you maybe did notice that your vision was going. And in the same way, the people around you in this situation in the hospital will sometimes see some of the symptoms of burnout. And it really happens in the most idealistic and the best employees. They're not people that have prior psychiatric history. They're the ones who went into healthcare because they care about people and they want to help people. So it really does occur in your in your best employees. So we developed this conceptual model that we've published where, and we say ICU environment, but it could be any environment where there are clearly organizational factors and personal characteristics that lead to some of the things that Tara talked about in terms of moral distress. It's very common in nurses where they want to do something, but they don't feel like they have the voice to express their concern on behalf of the patient. Perceived delivery of inappropriate care, that can sometimes be delivering too much or too little care. And as Tara talked about, compassion fatigue, where you just lose your ability to feel sorrow or sadness or any types of emotion around patients. And that leads to burnout. And then there are downstream effects of burnout. As Tara talked about a little bit and others, and we'll talk about in a second, there's some more extreme and more serious forms of psychological distress. What really brought this to the forefront is people started to realize that if your healthcare provider had symptoms of burnout, then you were going to get less quality care and the patients were going to be less satisfied. And as alluded to earlier, if you don't like your job, you're going to leave. And for the hospital administrators that might be on the call, burnout and psychological distress in healthcare professionals is expensive because turnover is expensive. Now, again, we use the term burnout, and I think, as I said, it's okay because it's raised awareness. But really, I think what's even more important that's embedded in burnout are people that have symptoms of depression and anxiety and post-traumatic stress disorder and suicidal thoughts and substance abuse that really can alter their ability to enjoy their life and also properly care for patients. This is this figure on the left is a combination of multiple studies of over 3,000 nurses. And what we identified is 29% of nurses in the intensive care unit have symptoms of post-traumatic stress disorder, and 21% meet the diagnostic criteria of post-traumatic stress disorder. That's higher than war veterans that returned from Afghanistan or Iraq. 22% have symptoms of anxiety, 13% of depression. And these are the three different components of burnout syndrome: emotional exhaustion, depersonalization, which is where you lose your ability to see your patient as a living human being. And if you're exhausted and you can't feel the humanity that made you go into the profession, then you start to think that you have decreased personal accomplishment and that you're not good at your job and you're not sure why you're doing it. What's interesting, if you put an or sign in between these columns, we identified that 80% of ICU nurses have some form of psychological distress. And we asked them, well, what were the triggers of that? It's providing postmortem care to a patient that you were talking about 3 or 4 days before then, seeing patients die and be involved with end-of-life care, combative patients, verbal abuse from family members or other physicians or nurses or other healthcare professionals, seeing open surgical rooms, massive bleeding, trauma-related injuries, performing futile care. As Tara showed in her video a little bit, performing CPR is a pretty horrific thing to see. And then nurses and other healthcare professionals sometimes feel overextended due to inadequate nursing and patient ratios, and sometimes the stress of not being able to save a specific patient. And then the pandemic hit. And that really, in one sense, from a silver lining, made people aware of this problem even more. But it just increased the amount of stress, as Jennifer alluded to in that wonderful video in the beginning, of how difficult it's been over the last 16 months to care for patients. There's this classic phases of a disaster, and the disaster can be a tsunami, an earthquake, or in this case, a pandemic. And in the beginning, there's this sense of heroicism where you're thinking, this is why I went to medical school. This is why I went to nursing school. These patients need us. This is exactly what I was trained to do. And because the employees and people working in a hospital have a common vision and a common mission to fight this virus, there's a honeymoon period where everyone's working together towards that common vision. And some of the barriers break down. Surgeons are getting along with medical doctors and anesthesiologists, and everyone's getting along in a very cohesive community. But over time, those sense of heroism in the honeymoon period fades away. And there's this prolonged sense of what's called disillusionment. And this is a normal response to a disaster. And what causes this disillusionment is that some people think, oh yeah, the disaster's over. I want to get back to life as normal. And we're sitting there going, hey, there's still an ICU filled with people that are on mechanical ventilation and life support systems due to COVID. And then people start to talk and realize that the response and the relief that occurred was not the same. And an example of that is Hurricane Katrina hit Mississippi also. It didn't just hit New Orleans. But when people looked at the amount of funding that was given by the government to the different states, it was vastly different. So of course, in that situation, the people in Mississippi felt that they weren't valued as much. And then people were afraid of getting infected and infecting their family. And there were several of us that were living in the basement of our houses for months because we didn't want to get our family sick before the vaccine came along. And I'll tell one story that I think is very telling about what the pandemic's done. So one thing we do in the intensive care unit is spend a lot of time talking to family members because the patients are on life support systems and under sedation, and you end up, in one sense, caring for the family members as much as you do for the patients. And you sometimes have very, very serious and emotional conversations about, are we doing the right thing for the patient? And is this what they would want? Would this meet their goals of care? And we used to have those conversations in person, and having those conversations over a Zoom conference call like this, it's just not the same. It's hard to read someone's body language and really connect with somebody in these very serious conversations. And what would happen is sometimes the family members would say, you know, my husband of 40 years never wanted to be on a life support system this way, and it's not in keeping with his goals of care, and I think we should remove him from the ventilator and let him pass away. And what's different about the pandemic is that at that time is when the family came in, because the one thing everyone is afraid of and nobody wants to have happen is for someone to die alone. But the family in the beginning of the pandemic and until very recently wasn't allowed into the intensive care unit. And we were concerned for the patient also. We wanted them to be comfortable at the end of their life. So what we would do, and I'd never done this before in 30 years of being a doctor, is I'd put on my respirator, I'd put on my face shield, I'd put on my gown, I'd put on 2 sets of gloves, and I'd walk into a patient's room and hold their hand while they died. And you could feel the life leave their hand. And you're doing that to help the patient and also to help their family members so they know somebody was there with them while their loved one died. So when people say, well, what's different about the COVID pandemic in terms of the intensive care unit, that's the story I tell. So what can we do about this? And we'll talk about 3 different things in terms of how can we address the psychological distress in healthcare professionals. The first is to reduce stigma. So this was a study that was published 6 years ago of medical students, and 52% of them had symptoms of burnout. And 33% of the ones with symptoms of burnout had sought some type of help with their psychological distress, and it might have been talking to family members or friends. When you look at how they answered specific questions, if they said it's a sign of personal weakness or inadequacy to receive treatment for emotional or mental health problems, close to 10% agreed with that statement. The residency directors would pass over my application if they were aware I had emotional and mental health problem, such as depression or anxiety, 50%. My supervisors would see me in a less favorable way that they believed I had an emotional and mental health problem, over 50%. If I were to receive treatment for an emotional and mental health problem, I would hide it from people, close to 60%. And this is all due to stigma. So how do we reduce the stigma of mental health? One way is that burnout's not really a mental health issue, it's an occupational health issue. In the same way in this picture of a coal miner, we would never blame them if they develop lung disease from working in a coal mine. We would say it's part of what they do. And in the same way, this psychological distress, as Tara alluded to, is part of what we do. And we need to incorporate it into our daily fabric and create a safe space so people feel comfortable talking about this. And one way to do that is sessions like this, to have leaders tell personal stories and destigmatize the issue. Dwayne "The Rock" Johnson, Lady Gaga, J.K. Rowling, athletes like Michael Phelps, Terry Bradshaw, and here Halle Berry have all talked about how they've suffered from depression or other forms of psychological distress and help destigmatize it. And then I think we should facilitate mental health professionals or participate in the support. And that's part of what we're doing through Carl. There are also organizational issues. Medicine's run too much as a business. I kind of say, if I wanted to work in a business, I would have gone to business school, but I went to medical school and Tara went to nursing school, and we did that for a specific reason. And we should be not just performing repetitive, meaningless, low value work, such as documenting and writing notes. We should be caring for patients in the same way the nurse who held Tara's hand when she was scared, that's what we were there to do. And people need to be visible in the hospital and help healthcare professionals through these difficult times. We're going to focus more on individual interventions. There's some caveats here. As we implement these interventions, we need to make sure we don't put blame on the staff and say, you know, if you didn't, it's your fault that that you have these problems. It's not their fault. It's an occupational health issue. And the individual interventions need to be integrated with the organizational issues. Also, we shouldn't just survey people unless we have solutions. And don't say that they should do something after already of a long day. It should be incorporated into their work. And as Tara mentioned, it takes a lot of time and effort to really change someone's mindset. In this famous picture of Muhammad Ali and Sonny Liston, the last thing Sonny Liston would need to hear is, you know, what you really need to do is go to a yoga class, where this is an occupational problem for him, that he was a boxer and getting knocked out was part of his job. I don't think him going to yoga classes would help too much if that's all he did. So with the help of the National Endowment of the Arts and in collaboration with the Ponzio Creative Arts Therapy Program at Children's Hospital that's run by Catherine Reed, and the Lighthouse Writers Workshop run by Michael Henry, who did a great job reading the poem to lead us off, we created the Colorado Resiliency Arts Lab. And the goal is to create a vibrant, collaborative creative arts therapy community that's committed to enhancing healthcare professional well-being and alleviating psychological stress in the workplace and beyond. And what we want to do is encourage healthcare professionals and providers to find an outlet, a creative outlet that they can identify and establish a sense of community. And this is our website, and I'd encourage you all to go and learn more about Carl. What creative arts therapy does, and Catherine and others taught me this, is that sometimes we don't have the ability to describe things verbally, and we just keep it bottled up inside of us. And what the creative arts does is it gives people a medium or a way to depict their emotional impact through a variety of forms of creative arts therapy, such as art, music, movement, or writing. And it's guided by a therapist, a creative arts therapist, who helps the individual and the group match the emotional impact and learn how to properly and healthily deal with their emotional stress. So I'm going to show a video that we made a few months ago that really, I think, describes what Carl's all about. This was a video to try to enhance people's desire to participate in our program. And I can tell you it clearly worked because people want to be a part of it.
I think healthcare workers see more suffering, in a week than most people see in their lifetime. There was one particular patient that I got really close to and actually fostered her in my home, so it became more than her nurse. And when she died in my arms in our PICU, it took a lot for me to come back. There's been many times that I've said, I'm not strong enough for this, and I think that's what we do, is we blame ourselves. Honestly, the only thing that got me out of that was starting to really understand why I became a nurse and reconnecting to my purpose with it, and meeting with people who were saying, during that whole time, you were caring for others, but you forgot to take care of yourself, and so this was inevitable for you. There's no built-in time for caregivers to say, what was that experience for me, or what did it mean? We have to care for ourselves so that we can care for others. And creative arts therapy is the backbone to that. I love that there's a writing expert and a painting expert and just experts on humanity and what humans need to be able to get to a creative place. Writing was the safest one for me, quite honestly. I would just start to write my stories out and allow myself to put it down and set it aside for a little bit. It wasn't that I needed to process and let it go, it's that I needed something to hold it for me so that I could not think about it 24/7. There's no magic pill for when you choose to care for others. The suffering's still there, the stress is still there. But what creative arts and resiliency practice and focusing on myself has given me is more space to hold all of that in. It's both simple and profound, and you deserve it. Healthcare workers just deserve to be cared for.
So what we're doing as part of CORAL is a clinical trial, and it's a 12-week intervention, and people get randomized to one of 4 modalities, either art therapy, dance movement therapy, music therapy, or a writing workshop. And then there's also a control group. And during the 12 weeks, we initially create a safe space. There's the next few weeks, people work through coping and expressing their opinions and their feelings. And the last is really this sense of community. And I think that's a big part of what the pandemic's also done is people feel very isolated. And I think what our programs helped with is to rebuild a sense of community. We are going to enroll 150 people. We're in our last cohort of 50 participants. And what was nice about this is there is a need. There's a waiting list, and more people signed up for the clinical trial than unfortunately we could enroll. And that doesn't always happen with clinical research. We'll be done with the study in the end of July, and we'll have the results over the next few months and be excited to present that in one of the future forums. The other thing we did is we created a lecture series, and Tara did a great job leading it off. This is, we invited arts leaders from around the world. As you can see, there are people from London participating. These occur every third Friday of the month from 12 to 1 Mountain Standard Time. I'd invite you to join CORAL and view these lectures. They've been phenomenal. And if the ones that you missed, you can go to our website and watch them. They're all stored there. So just to kind of conclude, I think before COVID, psychological distress was one of the more important issues in healthcare. And if anything, it's more important now. And I think one thing we can do is the world's aware of the difficulties we face. It used to be that people didn't understand or didn't want to hear about it. Now I think they understand in a very positive way. And I think COVID is an opportunity to help our colleagues and help ourselves. And I think if we do this in the right way as healthcare professionals, we can help with the stigma and utilize the pandemic to raise awareness of the mental health stigma for our entire society, so that we treat mental health issues like depression, anxiety, post-traumatic stress disorder, or burnout in the same way as we treat people that have cancer or high blood pressure or diabetes, without any judgment about their mental illness or psychological distress. So I just want to thank Kristen and Meredith and everyone for asking me to present on behalf of CORAL, and I'm really looking forward to the rest of this session.
Thanks for that, Mark. I think I'm up next. Is that correct? All right. I really appreciate what you presented there, Mark. I appreciate all the work that you do and how deeply you care about this work, and how creative and just good-natured you are about it. I've been working with Mark. Everybody at CORAL's been working with Mark for over 2 years now. It's always a joy. We have a lot of fun at our meetings. And thank you also to Tara. I really loved your presentation. It was incredibly moving. So I'm here to moderate the panel. I hope this is a pretty free-form, energetic discussion, and that you all, if you have questions, please post them in the chat, and I'll do my best to to read them and share them with the group, and we can just continue the conversation. So I think the best way to get us started is if all the panelists, if I guess one at a time, if you would like to just introduce yourselves briefly and perhaps just talk about what you do and what perspective you're going to bring to this panel. And I guess I'll just call out names and we can go from there. Does that sound good? So how about Gabby, could you go first?
Hi, everybody. I'm Gabby Mundy. Can you hear me all right? So I'm a nurse. I've been a nurse since 2012. I started out in heart surgery. I've also done ICU level care and organ donation and transplant coordinating. Now I work after a long time and on night shift and trauma nursing in the OR. I'm an OR nurse educator. So it's a really different perspective where I get to influence a lot of these things that we've just talked about or heard about. And it's really informative as to like the state of what our units like person to person are like on a daily basis.
Great, thank you, Gabby. And next, and this is great because I'm a poet, I like things that rhyme. So Abby, would you like to go next?
Hi everyone, my name is Abby Ahmed. I am a musician, actor, and educator based in Brooklyn, New York. I've been working with Tara and Resiliency Moments since its inception about a year ago, last summer. And I utilize yoga and meditation within the musical and performative scope to create a therapeutic and immersive experience for students and certainly for the guests and nurses that we work with in Resiliency Moments.
Wonderful, thank you, Abby. Next up, Kelly, would you like to go next?
Sure, peace everyone, hello. This is Kelly Greenlight. I'm calling in from Lamu, Kenya. I'm a performance artist, a cultural organizer, and a wellness worker, originally from New Jersey. And I am a part of the Resiliency team, creating a imaginative experience for folks who join my room. And I'm the founder at Black Arts Retreat, which is a hub for Black creativity. And I've been supporting artists of all sorts, and particularly those of the African diaspora around women's narratives, health and wellness, and creative expression for over 10 years. So I'm so happy to be a part of this project that intersects so many things I'm interested in. Thank you.
Wonderful, thanks for being here. What time is it in Kenya, actually?
It is 2:25 a.m.
Wonderful. Now that's resiliency, I have to say. Okay, so next up, Catherine, would you like to go?
Sure, thanks so much, Mike. I am Catherine Reed. I'm an art therapist, and I am the program manager for the Creative Arts Therapy program at Children's Hospital, Colorado, meaning I work primarily in the psychiatric department. With a very strong team of creative arts therapists, art, music, and dance therapists. We just hired our first drama therapist, excitedly. And we work with kids who are really acutely ill with all kinds of issues, including suicidality, self-harm, and anxiety, depression. So it's very intense work. So I've been thrilled to join Coral to study how creative arts therapy can also impact our healthcare professionals. So to move kind of to expand the capacity of a creative arts therapy program within a hospital to treat ourselves as well as our patients and families. It's been pretty fantastic working with this team. So thanks so much, Mike. And thank you, Mark, for introducing Coral so beautifully.
Thank you, Catherine. Okay, next up is Hillary.
Thanks, Mike. My name is Hillary Sin, and my heart is just racing and pounding, and I'm sitting forward in my seat. So something real is happening here. I'm very excited to be on this panel with all of you and for everyone who's participating and listening and showing up. It's really extraordinary, I think. This is a special moment and a special time. So I'm a dance movement therapist at Children's Hospital, Colorado on the Ponzio Creative Arts Therapy team. I primarily work with children in the Pediatric Mental Health Institute. So children and teens struggling with and living with a variety of behavioral issues, psychiatric issues, and was able to join Choral because Mark Moss faithfully reached out to Catherine Reed one day and asked if she knew any creative arts therapists. And then also to get to work with Mike is extraordinary as well, because we're full, whole human beings with words and movement and art and music, and so many other things to express. So I'm just lucky to be here. This is my second career, I will say that. I was originally an actor in New York, so shout out to everyone who's in New York City right now. And that's me.
Thank you, Hillary. You may be a dancer, but you certainly have a way with words. I really appreciate that. Okay, last but not least is I have great affection for this person. I've been teaching the creative writing part of the choral workshops, and Katie was one of my participants in the last session. So Katie?
Hello, my name is Katie Glowacki, and I'm a clinical social worker at Children's Hospital in Colorado. I got to participate with Michael and about 11 other people starting in January. And this was such an extraordinary experience that I had. And I know that the people that I went through this program with feel the same way. It was so wonderful. Mike was such a supportive person who drew us all out of being rather shy and not knowing each other, and becoming people who shared with each other the stories of our work, as well as the stories of our lives. And we were able to do that in a very creative way through writing. It was a wonderful experience, and I can't say enough about this experience.
Thank you, Katie. Your check's in the mail for that wonderful, wonderful comment. Okay, so I'm going to start out with a pretty broad question. Perhaps it's a deep philosophical question, so we'll see how it goes. And then I suppose we'll just it'll be a free-for-all. Whoever wants to just jump in and start talking. When I was a confused undergraduate biology major, I went to go see the psychologist Rollo May give a talk, and he said something that in many ways, I guess it changed my life because I'm still thinking about it. He said, all creativity comes from suffering. And I just find that such an evocative statement. So what I'd like to ask you all is, what do you make of that statement? And if you can, just talk a little bit about how it relates to this work.
I'll go first, if that's all right. I want to say that has to be a true statement, especially for healthcare professionals, because we suffer a lot and we are really creative with how we solve problems. So I think as we get burnt out and as we kind of lose that drive and that motivation as we go through that curve, that was demonstrated in one of the earlier slides, and we're down at the pits of it, I think it's really easy to just stop wanting to put in the effort to solve the problem. And so we all kind of lose momentum together. And it's definitely like a group effect. So I have to confirm.
Thank you, Gabby. Anybody else?
I'll go next. Mike, thank you for such a juicy question. I love it. It brings to mind myself and my own story, because I believe that all of us creative arts therapists, at least, and probably all of us in general, really bring change and transformation through our suffering. So I realized that art was going to help me when my brother was sick and dying of AIDS back in the 80s. And it was my art that made sense of it to me, because it didn't make any sense anywhere else. And so I was making art and photography at the time, but also all kinds of different multimedia visual arts that helped me make sense of my grief and watching him die in a way that didn't make any sense on any level. And because I know that the art got me through that, I was later in life able to use that same concept to become a healer. And I'm so grateful to have found a path in that sense, because I think we get really lost sometimes when we can't find our way to express things that are beyond language, like grief can be, like suffering can be. And so I just love that question and that quote. And thanks, Mike.
Thank you, Catherine, for that. I appreciate your honesty there. That's it's just personally very meaningful to hear that. Anybody else want to try to respond to that quote?
Yeah, I would like to. I'd like to have a word with Rollo May, actually, because I think it's true. I don't think that what he said is wrong. I also don't think it's the whole story. I think a lot of creativity comes from joy and pleasure as well. And so suffering is a way that we can, of course, if we're willing to speak it, acknowledge it, speak it, we can connect to others through suffering, and certainly make wonderful, beautiful projects. But I really encourage people to remember too that we can affirm our positive experiences and our successes and, like I said, pleasure and joy through art as well. So that's really important too. And to learn how to reach out to other people when we're also feeling happy, learning to reach out when we're suffering, also learning to reach out when we're really loving ourselves as well.
Thank you for that perspective. I think that's really great. Why does it have to be just creativity? Have to be, about this really heavy stuff. Anybody else? Last chance.
I would like to tag team on what Hillary just said and add that sometimes when we're in our darkest moments, we can use art and creativity to get to a better place and to work through that suffering to find the joy. And that was something certainly that I have seen many times in my own life.
Thank you for that, Katie. That's very true. It reminds me of the idea that the function of art is to create beauty. I mean, there's lots of functions of art, but I think one of the basic ways that we've always considered is art is a sort of a testament to the creation of beauty, and beauty, should bring you joy. And I think that makes a lot of sense. A quick follow-up with that question, and I think sort of, again, hopefully I'm not too philosophical here, but I'm curious, in your sense, do you think that this work around building resiliency and connection among people who are caregivers starts with the artistic process or with the or through a therapeutic lens, or both, or neither?
I'll start again if that's all right. I think it has to start with permission. It has to start with this space that is allowing a person to be their whole self. And that's what this work offers that's different from a lot of other programs and in-work systems that are trying to be added to workflows and that sort of thing. This is a permissive space where somebody can be their whole self, including their creative self, and really dive into what it is that they're experiencing on every level, physically, emotionally, spiritually, and move forward with that better understanding into novel experiences and applying their new knowledge and their new tools to these novel experiences to be just a better whole human, and to allow their patients and their coworkers and their leaders to be better whole human beings through the process.
Wonderful, thank you. Anybody else?
I saw Abby, yeah, there we go.
Oh, go ahead. I was just going to say that I think that safety is of most importance. There has to be that mutual respect, that mutual understanding for any emotion to arise. But I think the key is finding flexibility from person to person, because there is no standard need for every single person that you work with. And being able to be flexible in a moment, to find that pathway in, is the utmost presence that you can share with a person.
I'd just like to add, I think they're one and the same. Like, I heard you talk about, like, are we concerned with the art of it? Are we concerned with the therapy of it? But I think they really come together. When you see yourself reflected in someone else's creation, or something is coming out of you that expresses, how could it not be therapeutic? I think that regardless of the intention, even if you're just, noticing someone perform on the subway, for instance, I used to live in New York, you can still have a moment of catharsis, a moment of release, a moment of connection that heals you in some kind of way. So I think from a very young age, I always understood that art and healing came together.
Amen. I love that. That is so true, right? Anybody else want to chime in? Okay, looks like we have, do we have our first question here? Let's see. I'd like to hear from Kelly and Abby on what it has been like to work with healthcare professionals, if they've adjusted their creative practice at all in those moments.
Kelly, do you want to start?
Go for it, Abby.
Each one has been so incredibly different, and everyone comes in with a different availability to how they want to endeavor into the creative work. Some come raring to go and have a basis of their own creative practice that they want to contribute and get really excited about the collaboration. Some are really in a place of not feeling open to the journey at the beginning, or unsure, that vulnerability that's there. What I like about the moment that I've personally created is that there is a mutual vulnerability. There's an element of improv on my end, which I think creates an equal playing field for, we both don't know what's going to happen here. I will hold space for you along that path, and we can endeavor it together and ride the ebb and flow and see what's on the other side.
Yeah, thank you, Abby. I'm reminded, Mike, of your first question around where creativity comes from. And just thinking about, you know, once that person enters into this kind of one-on-one zone, it's like, once that connection is sparked, just things start to roll from there. You know, once you see whatever this setup is that the artist has created for you, you're on this journey together, as Abby was speaking about. And I think what's so special about these moments is to be able to offer this kind of creative mental break, and this thing that's so out of the ordinary for, you know, folks who are used to a particular sort of routine, folks who are used to just working so hard at every moment, you know, and someone's like, hey, what about your imagination? And it just feels amazing to be that person, you know, to catalyze that experience for someone. It's like so, I can't describe it, actually. It really warms my heart. So it's a very special experience.
It feels like an honor almost, right? It's almost the sort of sacred kind of moment, I think. I'm curious, and for both of you and then others also, that a sense of idea of vulnerability and actually sort of displaying it first as part of the sort of the leadership process. Do you think that's absolutely necessary, and how does it kind of work?
I don't know that it's necessary. It is for me in my specific moment that I've crafted. But I think that it depends on what the modality is. It depends on, again, on person to person. Every interaction between two people is a different kind of chemical experiment. So being conscious, being present, and learning how to navigate within those waters is, I think, number one, a priority, rather than necessarily being vulnerable. Empathy is essential, for sure. I don't know if straight up vulnerability has to be there on the part of the artist, but most artists and creative people are incredibly vulnerable and willing to share that, so.
Yes, well
Yeah.
said.
Yeah, I'll kind of pick up off this word of willingness. I think that's what stands out to me. Willing to be open. I think as a facilitator, it's important not to ask anyone to do something that you wouldn't do yourself, you know, or to share anything you wouldn't then share or first share. So if I'm asking someone for a story, then I have a story also, you know, and I think it's just, you know, great to lead by example in that way.
I agree. Thank you so much. Okay, so next question. How can we use the arts to reduce the stigma of psychological distress in healthcare professionals?
I have to say personally, as a participant in the clinic with Tara Rynders, it was very sneaky. You know, I thought I was coming in on a research project, and I knew we were gonna talk about burnout, but we got there and we were just playing. We were thrown completely on our heels, and the professional demeanor that we walked in with as nurses and as medical professionals was irrelevant, because we were human beings playing in a space together with a common, experience that we could validate for each other, and together with artists who led the way in the play. So there are these muscles that we are taught to turn off in order to be professionals. We're taught to kind of turn off imagination, turn off play, turn off creativity sometimes, and we end up sort of playing a role as a professional instead of as whoever we are and whatever we can bring to the table. And it kind of stifles how we can move forward with the hard things that we experience, the grief, the witness trauma, the just really hard days and the really hard work that we do. So I think play is a really big factor in it.
It's beautifully said. I think I always see in the workshops that one person will show that vulnerability and have that courage to sort of, read something they had written about a really difficult day. And then suddenly there's this immediate sense of like, everybody else in the group, I've had that experience too, and I've never talked about it. I'm so glad that you did. And then they're eager to start sharing their stories as well. It's almost a little bit like a domino effect. And I think it reduces the stigma, because then they realize they're not the only person who's experienced this. And then also they see other people wanting to tell those stories and share that, which is really powerful. Any others have responses to that question?
One of the things that I think is important in this whole process is the fact that we got to meet for a number of weeks, and we met with the same people, because you go into a group, and we had about 12 people in our group, and we were all strangers. Many of us worked at the same hospital, but didn't work with each other. I think there were 2 people in our group who knew each other before they came into the group. Over the course of time, we grew to know each other, and that was through our writing, and that was through the support of not being forced to do anything, but the opportunity to share. And as a result, I think people became comfortable over the course of time, and that is the role of a group, is to bond as a group of people. And you can't do that if you participate in something like this for a shorter amount of time. I think 12 weeks was great. I know there were many people who wished it was far more than 12 weeks.
Katie, thank you for that. I will also want to add just the concept of expanding that idea out, right? That when sharing and vulnerability becomes a norm, that I think stigma can really be reduced. And I think about that on a cultural level, and I think about artists as really the biggest culture changers. So if we find people who are brave enough to be real and to talk about depression, anxiety, psychological distress, and give them a vehicle that looks like the art, use the arts as a vehicle to make it normal to talk about. I can imagine not only the healthcare profession shifting and changing, but I can imagine culture shifting and changing. And we need it desperately right now. We're having a mental health crisis across the board. In fact, Children's Hospital, I believe just yesterday, made public that there is a mental health state of emergency in our state for our children and adolescents. So, it's an incredibly important question, reducing the stigma so that we can make not only the conversations and the vulnerability normal, but also the expressions. And the artists, I think, are the best leaders in that realm.
Thank you for that, Catherine. Anybody else?
I would just add that sometimes we don't even know what we're dealing with, and art provides a space to name, and to just identify, or at least talk through something. You're like, wait a minute, I've said this 3 weeks in a row, you know, when we're on the hamster wheel or whatever we're doing, it's not always so obvious, like, oh, I'm going through something, you know, but when you provide space for dialogue, and then in order to create, we need to step back a moment, right? And so you have this kind of seeing yourself, seeing this kind of meta experience of yourself that kind of gives you that distance and that perspective to be able to say like, oh, something's happening, you know, but when you're in it, sometimes, often we don't even know, you know? So art just kind of gives us that zoom out that we need. And then when you couple it with dialogue, so powerful, because then you can talk through, and again, as I said, name and identify what's happening. So super critical.
I love the way you described that. I think I heard a writing instructor talk about, and this is an awkward phrase, but write what you don't know that you know, and in many ways, you know, the artistic process is in some ways the creation of a mirror in which to see yourself fully and clearly. And I think once you do that, then it allows other people to see you fully and clearly. And those are two very powerful moments, and often they happen one right after the other. And I think that's sometimes what you see when you're doing the work. You know, you're in the workshop, you're in the session, that you see that kind of, you know, for lack of a better word, that magic sort of happen. And that's what I absolutely love about doing these workshops. Anybody else? I have a really cool question next. So, but I don't want to cut anybody off.
I just want to add to what Kelly had to say, that there's this sort of aspect of modeling by our artists, because when we're in this professional realm, like I said, we're taught to turn off these muscles. And so the artists are really modeling for us how to open up the space as well. So not only do we open it up for ourselves in the experience and in the resiliency moments, but we carry that forward and we learn how to open it up for other people along our path. I think it's really invaluable.
And I'll just jump by saying, and we, as artists, we model different diversity of how that can be done. I loved what Katie said about having this long stretch of time to really get in. For us, it's 10 minutes and that's the only encounter, and they're just as powerful. And that's the beauty of being an artist, introducing people the diversity of ways to have creativity in your life and to keep it interesting, and to hear the same thing said a different way and have that be the spark that allows you to integrate it in a more permanent way into your life and your healing.
I have to ask, what do you do in those 10 minutes?
Well, I hope you'll see in our resiliency moment if you join the chat.
All right. Okay. Oh, this is a great follow-up question. This is different than one I was really excited about. I'm going to keep that in the hopper for a second. And this is related to what we were just talking about. So for Hillary and Catherine, how do you take care of yourselves and your own mental health as arts therapists? And I guess anybody can answer that.
I was really hoping you'd answer first, Catherine. So to model some vulnerability, in the course of this past year, I didn't do a very good job. And that's partially maybe decisions I made or didn't make, and also circumstantial. So I want to try to remember that we were all in a crisis, and that there was a global trauma taking place with the pandemic. And I also really struggled a lot personally. So a way, though, that I have found in the midst of really being in the vice grip of struggle, laying down horizontally, just very simply being horizontal on the ground, and letting all of my weight just go and be in a state of surrender and be held by the bed, the floor, the earth. Something very simple like that can really shift perspective and what's happening in my nervous system.
I will say that for me, getting through the last year and in general is all about conscious decisions, because I think it's very easy in our work, as Hillary described so eloquently, to really be overwhelmed, to be exhausted, to witness the level of suffering of kids and teenagers it's hard. So for me, getting outside is huge. We work in a basement at Children's Hospital, and we have a beautiful labyrinth at the hospital that's right next to our emergency department that is meant to be used for these purposes. And I visit that labyrinth at least once a week, and I slow down and I try to slow my whole system down and just breathe. I try to make art, but admittedly, I haven't made a lot of art in the last year, but I've really leaned into community. And I think playing, as you spoke about, making things with people at the hospital and really being able to help has given me a great amount of comfort. So, I mean, doing this work, I have to say, being part of Choral has been incredibly gratifying because I'm able to witness people's stories. I'm able to bring paintbrushes into the hands of doctors who have literally not touched them since they were kids. And watching people transform through the really the magic of making art has been very humbling.
Thank you both for those wonderful answers. I think there's the creation of the art, and then there's the sharing of the art, whether, you know, in the workshop experience, but there's also just sort of the being the audience of art, whether it's, you know, looking at visual art or reading a book or, you know, watching the new Netflix series on TV. I mean, they're all art forms and they're all creations. And I do think there is a value in sort of being an audience member as well. That can be powerful too. So another fairly specific question, this is for Gabby and Katie. Have you continued your creative practice on your own after being introduced to these programs? And no pressure, Katie, if you haven't written a word, that's all right.
I think about writing every single day. I think about it. Mike, you did say something in class, and it really is the Nike sort of mantra, which is just do it. That with so many things, it doesn't have to be good, you just have to do it. And over the course of time, if you continue to do these sorts of things, some of it will be better than others, but you can look back over your body of work and then be able to say, well, look what I did. I did the Nike thing, I did it, and look what I have to show for it.
I would say I absolutely have continued flexing that creative muscle, not just like in my home life, but I take it to work and I look for those things that can be passion projects that can carry my fulfillment forward, and maybe model that for somebody around me. Really put myself into something that fulfills me. But I also do photography and I also do some creative writing and some music. Tara really tried to make me into a dancer during the clinic, but it just didn't really happen. But every once in a while I get a little buggy even, and it's just, it's really lightening. You just feel lighter after you let some of this out in any setting.
Well said, well said. And I think there's something to be said for just thinking like an artist, you know, even if you're not just sitting down and writing or painting or you know, doing creative movement, thinking about it is a little bit of a shift too. And hopefully, you know, you don't put pressure on yourself or you don't berate yourself for not having done it for a while, you know, then, you know, if you're thinking about it for a while, maybe at some point you will sit down and you will start engaging in the art again. It sometimes it's okay to sort of let it be fallow for a while. Okay, here, this is probably I'm sensing this will be a final question. We're going to wrap up at 6 p.m. So this is a question for everybody. What would you say to artists who are interested in getting into this kind of work? I really like this question is because I'm not a trained therapist, I'm a writer. Do you need any particular training or how can you begin working at this intersection?
Mike, I would love to hear Mark Moss answer that question because he's been such a leader in the networking.
Wow. I think that's a difficult question. I think it depends what your goals and objectives are. And I think I always think about it that before you do something, what are you trying to achieve with that? And I think there's so much to be done in this area that I think you don't have to be a creative arts therapist to get involved. There's a lot that can be done. This can give you a inspiration for your artwork, and then tell a story about how this affected you and get the story out there. I still think people don't quite understand the depths of psychological distress for healthcare professionals. And the way I kind of describe that is that 400 physicians commit suicide in the United States each year. That's 2.5 medical school classes, and people don't talk about it. So I would say figure out what you're trying to achieve. And it might just be, as we were talking about, raising awareness, or telling your own story, or telling a story for someone else. And I think anything that people do in this area, I think it's a movement, and I think it's growing. And I think the more people get involved in their own way, we're going to make a big difference. And it's not just a difference for the healthcare professionals, but as we alluded to, if your doctors and nurses are in a better place, everyone's going to get better care. There's a huge trickle-down effect from this. So I would say just get started and do something. And if that's going and getting your inspiration for your artwork from the healthcare arena, then do that. I think there's tons of things that can be done. Did I do okay, Catherine?
I think you did fine, Mark. How about anybody else want to address that question?
Well, I would just say really quickly that you can also reach out to us. I think if anyone's interested in collaborating, one of the things that we're doing with Coral is trying to help these two communities of the healthcare world and the arts world, especially in Colorado, really build bridges and network. And Mark's been an incredible leader in that aspect. So we have a lot of resources and a lot of support from the National Endowment of the Arts, hopefully in the future from the National Institute of Health. So check out our website at Coral. And I know that Tara Rynders also has a lot of incredible networking savvy. So reach out to us. Let's network together.
Yes, definitely reach out. I think that's a great way to continue the conversation and to keep learning and just seeking out new opportunities. We do have a final question. I think if one person wants to take this one, because I don't want to run over time, but this comes from Meredith, so I'm assuming it's okay if we go a minute over. What can we do as a general public to support this work in big or small ways? How do we channel and leverage all the inspiration from today's forum? It's a pretty heady question. Anybody want to take it?
I'd say make it known, make it a priority, give it space, give it resources. Anything that you can do to open up a space for wholeness and for whole humanity in your own practice is going to carry this forward. But also, get the word out. Let people know that this research is happening, that these resources are available to them, and that they can move forward with more to deal with what's going on, because everybody is experiencing a really rough year, and a lot of people more than others, and a lot of people in healthcare more than others. So give it space.
Mike, can I add something to that? I would agree with what Gabby said. And I think this, as I said, is an opportunity. And I think it's an opportunity to tell the story. And I think the CBCA and the arts community has the ear of the public. And I think they can help tell the story to the public. The example I give is a long time ago, I went to the symphony, the Colorado Symphony, and there was an art exhibit there that were photographs of women with breast cancer, and women without hair, women missing a breast. And it really told the story of breast cancer. And I think it raised awareness at the time, seems obvious now, about the issues of breast cancer and how it affects a lot of people. I think in the same way, the arts community can help tell this story and get the word out. And I think the CBCA and other arts communities in the Denver metropolitan area can get the word out. There are still people that don't understand the depths of the issue.
Great. Well, with that, Mike, I was going to let you wrap us up, but I don't see you. I don't know. You went away from my screen. So I don't know if we lost him, but I would just like to thank Mike for facilitating what's been a really engaging and interesting panel discussion. Thank all of you for the work that you're doing and your honesty in this topic and sharing your personal stories. And I think all of you are really fascinating. I know it's been really interesting to listen to all of you. So just wanted to thank all of the panelists. So now to close out this portion of the forum, I'd like to invite Tony Edelblut, a music therapist with the Ponzio Creative Arts Therapy Program at Children's Hospital, Colorado, to share the song created by his clinical trial cohort. So we get to see some of this in action, which is really cool. So I'm going to turn it over to Tony.
Hi, thanks everybody. I apologize that I wasn't able to get here early enough to do a sound check. So I wanted to say, I won't talk too much, but I wanted to say a couple words to give you context for what I'm going to play. And I'll play a couple chords along the way. So if there's somebody like doing levels or something and you need to figure that out. Okay, so this was actually the song that was written by the second of 3 cohorts. Something that Abby said earlier that really resonates is that each group comes in kind of with its own personality and its own pre-existing skill sets and their own levels of sort of willingness to kind of go into that space of active self. I think of it as a space of active self-reflection. So this particular cohort, just to give you context, the first cohort, we did what I consider a more kind of traditional music therapy song, which is we sat in the room and we did some lyric writing exercises. And I would sit there and kind of give them choices like, are we doing more of like a happy song, like with those kind of chords, or are we doing kind of more, are we kind of like, what kind of different moods are we creating with what we're doing musically? But the second cohort, its personality was that they were a very lovely group. However, they were very deer in the headlights when I would try to say, hey, let's turn over some creative control to you guys. So what ended up happening with this group, just to give you guys context, is that the way I solved that issue was that we did our lyric writing and they were like, why don't you do it? And I said, okay, just because, because different groups need different levels of support. So I took all the stuff from their lyric writing exercise and things that we had just talked about, and I put together a song. And the other part that as I sing this, it's a little bit weird because I didn't want to just sit there and sing a song. I wanted to like make parts for them to sing, and only 1 or 2 of them had any musical training at all, so I tried to keep it simple. So just to give you context, when I'm singing, there's a couple parts I'm going to cover that are really meant for the group to sing. So I'm just going to give you a quick moment here. So there's like this introduction, and it goes like this. It goes, you and me equally. You and me equally. And that's the whole group, right? So we're just kind of grooving along, and I taught them that little bit. And so that kind of comes back. And then there's a bridge to the song where they found it cathartic just to kind of like talk about all the things they were mad about at the hospital and then their work. So there's a lot of shouting of no. So I'll try to like go a little bit off mic just to cue that it's not me, it's the kind of crowd singing it back. So there you go. All right. So here's a song, and it's called, the song's called Empty Cup, which I got from a metaphor that one of the group members used like 3 weeks in a row as she started to really understand how much she was giving without doing any kind of self-care. And so she just kept, every week was like, you can't pour from an empty cup. I'm like, okay. So that was the hook. So here we go. You and me equally. You and me equally. Here it comes, another message. Stop to breathe for a second. There's so much news that I'm dreaded. Why do I jump to conclusions? Not sure how I'd use them. I'm not sure what the truth is. Wisdom grant me the grace to occupy my own space and know which way is up. I do my best for me, and you equally can't pour from an empty cup. You and me equally can't drink from an empty cup. You and me equally. You and me equally. But I declare that I'm sufficient. So many times when I didn't. Balance taking and giving. Can't blame me if I'm shaken. All the shifts I have taken. Still my joy is awake now. Will I stay silent? No, doesn't matter what they think. No, will I hold all in? No, will I bend till I break? What? No, will I stay silent? No, doesn't matter what they think. No, will I hold it all in? No, will I bend till I break? No, wisdom grant me the grace to occupy my own space and know which way is up. I do my best for me, and you equally can't pour from an empty cup. You and me equally can't drink from an empty cup. You and me equally can't share an empty cup. You and me equally can't pour from an empty cup. You and me equally. There you go. Yeah.
Thank you so much, Tony.
Yeah.
That was really inspirational, really cool. I was like starting to sing along with you here. So just to quickly transition, I want to make a few closing remarks before we go into our breakout groups. First, I just want you all, you can give a thumbs up or in the chat, just join me in thanking all of our speakers today and performers today. We appreciate your time and candor and sharing your moments of vulnerability, creativity, and hope with us. We're not done. We have a few artists who have joined us today to lead these one-on-one resiliency moments, and I hope many of you have signed up for these. I know I have. As you heard, the clinic has been offering these virtually, and we're excited to give some folks here tonight a chance to experience it. Soon we'll disperse into breakout rooms. If you requested one of those moments earlier, you may be zoomed into a breakout room with an artist. Each moment lasts 10 minutes. When you're done with your moment, please return to the main room or exit the meeting, and you'll have an opportunity for a second round of resiliency moments. Everyone else will join one of the general networking rooms for small group conversations. And before we zoom off, I'd like to thank our Arts and Wellness series sponsors again, College of Arts and Media at CU Denver, Denver Business Journal, the Melvin and Elaine Wolf Foundation, and Pulcinelli. And I'd also like to thank the Center for Bioethics and Humanities at CU Anschutz for supporting this forum tonight. Each of these organizations is doing such incredible work in our community to support both the healthcare field and our creative sector, so thank you. So with that, one last comment, save the date for our next forum, and hopefully we can put it in the chat as well, Rachel or Meredith. Our August 25th forum will be focused on self-care and mental health, as Chris mentioned earlier. And then on November 30th, we'll be focused on health equity and accessibility in and through the arts. And we certainly look forward to hearing from Dr. Moss about the results of the clinical trials and your learnings there. So we'll be excited to hear that. We'll look forward to seeing you at future CBCA events, and thank you for participating, and take it away to the breakout rooms. Thanks, everybody.